Hi, I'm Dr. Nicole Jordan. I'm an audiologist at George Washington University Speech and Hearing Center.
Hi, I'm Rachael Purcel. I am an audiology student at Gallaudet University.
And we're here to talk about fall prevention from a hearing and balance perspective. First, hearing is important to be aware of your surroundings. So if you have hearing loss, it may be important to look into something like hearing aids or any assistive devices to help you hear better so you can add to your general safety with surroundings. And this certainly has some effect on your balance, but we're here to talk about something different in that hearing loss can actually be a symptom of a vestibular disorder, which is a balance disorder that occurs in the inner ear. So the ear is not just for hearing. There are parts of the ear that are important for balance. When we talk about balance, there are a few things that we like to talk about in terms of what adds to your general balance. Somatosensory inputs, like how you feel when you stand on the floor, being able to have that feeling that you are steady on the ground. Vision, or of course what you can see. And then hearing, your surroundings. And what we're going to talk to you a lot about today is vestibular inputs, which is that portion of the ear that's going to add to that balance. When we talk about anatomy and physiology, this will be really easy, I promise, especially of balance. We talk about joint and muscles, being able to feel yourself on the floor, that proprioception I was talking about before. Your vision and how you see the world around you. So when you are driving in your car, you see what's in front of you. When you're maybe on the train or metro and things are going by, your eyes are able to track things through the window. Any eye movement that has to do with that. You have control of your muscles and motor skills. So when you walk, you're able to lift your legs up and put them forward to walk. Your posture, or how your spine connects all of your muscles and nerves across your body. And then that, of course, goes to the brain. All of these connect to the brain, as the brain has control of a lot of your balance system as well. What we're going to be talking about today is the vestibular portion of your ear, which is this right here. You can see these loops kind of all connect. That's going to be in the ear. So when we talk about ear anatomy, we have the ear right here. We have the ear canal. We have the eardrum. And then past the eardrum, we have what's called the middle ear, which is an open space that has the tiniest bones in our body. Past that is going to be the inner ear, and that's what is pictured here. These little loops here we call semicircular canals. These are going to be what's mainly the main portions of the vestibular system, or the portions of the ear that control a lot of the balance. We also have the utricle and the saccule, which also play important roles.
All right, and so if you suspect that you might have something wrong with a vestibular or anything with your balance, we have a list of possible symptoms. That could be a false sensation of motion or tilting. So when you're still, you feel like you're moving. It could also be if things around you are moving, or if it looks like the room may be spinning or just maybe moving a bit. You can have visual distortion. So you can also have blur. You can have difficulty maintaining an upright position, and that is standing, sitting, any way that you are like this. And then also some nausea, which can happen a lot with dizziness. All right, and so vertigo, that's a word that we're going to use a lot. And so what it is a sensation of motion when no motion is occurring, or the sensation of distorted motion during otherwise normal head movement. You might feel like a head rush if you just turn your head to one side, is what that means. And then just to clarify further, we have this picture here, which describes vertigo versus disequilibrium, lightheadedness, or presyncope. And all of these are important for when a doctor is taking your case history for an issue you think you might have. So we just explained vertigo, and then disequilibrium is just feeling off balance, unsteady or wobbly. Lightheadedness, you could feel woozy or disconnected from your environment. And then presyncope is the feeling as if you're about to pass out. And so when you go to the doctor, they're going to start off by asking you some questions. And so for this, we talk about vestibular symptoms. So we're going to ask you about vertigo, which we just talked about, and we'll try to decipher whether you're having vertigo or dizziness, because that can mean different things for us. Time course of when did it start? Is there anything that triggers this or provocation? Frequency, does it happen often? Is it every once in a while, maybe once a month, or is it every day, every hour? Duration is how long it can last. Some vestibular issues can last for a couple minutes and then stop. Some last for hours or days. Is there anything that you can do to trigger it? We talked about, but also is there anything that you can do to make it better? Like if you sit up, if you were laying down, is that something that it's better? Then it's also important if we know that if you have any hearing loss that you know of, there are other relevant medical conditions. If you've ever had any type of head trauma, if you have tinnitus, which is ringing in your ear, any vision issues, if you've been sick recently, that can actually help us with your balance concerns. Sometimes if you get sick, like a sinus infection, that can affect your ears too, and that's important for us to know. If you have any previous medical diagnoses, and then if there's any pain or if you have issues with range of motion, we need to know that for testing. If you have any drug or alcohol use, and what medications you're on.
I want to just highlight really quickly some important portions of the medical conditions. Any head trauma or anything that has to do with possible damage to the head is important because that, of course, affects the ear. Tinnitus, which is a ringing, buzzing, hissing, any sound that you perceive in your ear when there's no external sound present, that can tell us a lot about any possible dizziness symptoms you're having. Any vision loss. Sometimes your unsteadiness or dizziness could be a cause of vision problems rather than that inner ear or vestibular problem we're talking about. And then other illnesses that may coincide with dizziness. Previous big medical diagnoses are important. These could be cancer, autoimmune, Parkinson's, stroke. Any of those are very important to tell your doctor. And medications are important because they can affect our balance system and feelings of dizziness. We wanted to list some vestibular and inner ear balance disorders that are fairly common. I want to point out that these are just some of the many. So I grabbed a few that are maybe more familiar to you. Probably the most common that we hear about is BBBV, which is benign paroxysmal positional vertigo. This is easily fixed in an ear, nose, and throat doctor visit by an ENT or ear, nose, and throat doctor who is very familiar with dizziness and balance issues. Some of the symptoms that occur with this are that vertigo sensation, which occurs with changes in position. So if you're laying down or rolling over. The vertigo sensation tends to last seconds to maybe a minute, but no longer than that. Vestibular neuritis, vertigo often lasts hours and may coincide with an illness or a virus that you recently had. Vestibular labyrinthitis, the vertigo can again last hours, but also coincides with a hearing loss. This could just be a one-sided hearing loss. And this hearing loss could get better or it could not. It's very important whenever you have a sudden change in hearing or a sudden hearing loss that you contact your doctor immediately so you can get referred for a hearing test as soon as possible. Studies show that medical intervention within the first 24 to 48 hours of a sudden hearing loss are very, very important for restoring hearing and potentially balance concerns if you have any balance concerns with that as well. Semicircular canal dehiscence is a big one. Individuals with semicircular canal dehiscence also often notice symptoms of ear fullness, or where their ear seems to be plugged. This is oftentimes a sensation that you might notice when you go up into the mountains, if you're driving up into a high elevation, or when you're flying in a plane, your ears feel like they need a pop. That's aural fullness or ear fullness. They might notice that sounds are echoey in their ear. They might have a sensitivity to loud sounds, and then they'll of course have that sensation of vertigo. Meniere's disease is something that is often falsely diagnosed. It's actually not as common as you think. It involves sudden episodes of vertigo and hearing loss. Vertigo may last hours or days, and hearing may improve or may not improve after these episodes. Oftentimes, individuals with Meniere's have a roaring tinnitus, which means they almost hear the ocean in their ear when there's no external ocean sounds coming in. It's really important, if you have any of these symptoms, to go see your ear, nose, and throat doctor, specifically one that specializes in balance and vestibular disorders, because it's really important that they diagnose that rather than your primary care doctor, since I oftentimes see it falsely diagnosed. We've got migraine associated with vertigo or vestibular migraine. Oftentimes people have a horrible headache or migraine. This is associated sometimes with vision problems or vision aura, where different lights and colors sort of blend visually together, and also associated with vertigo. Acoustic neuroma, vestibular schwannoma, which is a growth that occurs on the vestibular portion of that nerve that is associated with the inner ear and that area of the ear. That oftentimes is associated with hearing loss, tinnitus, and vertigo. Perilymph fistula, which occurs in a portion of the ear where certain type of fluid exists, and for whatever reason, that fluid, there's a sudden leakage of that fluid, which causes vertigo, ear fullness, again, that feeling of the ear being plugged, and symptoms may change and may worsen with coughing, sneezing, increased pressure. So if someone bends down and then lifts their head up, that could change the vertigo and the tinnitus symptoms as well. There are many more other disorders that we just don't have listed. So the big thing is, if you notice any sudden changes in your hearing, any tinnitus, any vertigo, especially vertigo is the #1 symptom that we look for, to talk to your doctor and get that referral. So let's talk a little bit about referrals and interdisciplinary teams. What do you do when you have that sensation of spinning, or that the room's moving, that vertigo that we described? When you have a sudden change in hearing, when you have tinnitus, first and foremost, talk to your primary care doctor. Your primary care doctor should take those symptoms and likely refer you to an ear, nose, and throat doctor that specifically has a lot of experience with balance and the ears and vestibular disorders. That ear, nose, and throat doctor may not be available, and instead they might refer you to a neuro-otologist, which is a ear doctor that also specializes in neurology, who has a lot of experience with these balance and vestibular disorders. In addition to that person, you might get referred to a neurologist as well. The neurologist can help oftentimes further diagnose your balance problems when it has to do with an inner ear disorder, especially if it has to do with that nerve that I spoke about before. So when necessary, your ear, nose, and throat doctor or your neuro-otologist can refer to the neurologist. After you see that ENT, they may refer you to someone like myself, an audiologist, who specializes in vestibular testing. So not all audiologists do vestibular testing, so it's important that your ENT know to refer you to someone who does. After your audiologist sees you, They'll go over their test results and also refer you back to the ENT for further discussion. The audiologist and the ENT will work together to determine what the best management plan is. As far as management goes, you might be referred to a physical therapist for some training with balance and training with to help decrease chances of falls. And then if necessary and if it's appropriate, you might be referred to a pharmacist to pick up medication that will help improve your symptoms.
All right, and now we want to just go over a few common questions that we could think of. And that would be what technology is out there to help with hearing loss and balance. And so what you want to do is check with your audiologist about improvements in hearing technology. There are always new hearing aids coming out, and if you're interested in an update, talk to them. And there are new hearing aids that even have a fall prevention feature where if they sense that you fell, they will have a little update on your phone and will actually message someone for you. How do you know if you have a vestibular disorder? Usually vertigo is the #1 thing that we look for. Who do you go see first? Like Dr. Jordan was saying, we always want to talk to the primary care doctor first because they will know who to refer you to. And then you will see either the ENT or otologist, like we were talking about, who specializes in vestibular or inner ear disorders. And then what treatment looks like depends on the diagnosis. Like Dr. Jordan was saying, sometimes there's physical therapy. There are certain maneuvers that a doctor can teach you that may help. There's activities you can do just on your own. And then there's medical intervention where you might have to go to the pharmacist and get a prescription. Sometimes there's surgery, physical therapy. There's a lot of different options just depending on what your diagnosis is. And then for clinics that are in the area, we have the GW Hospital, the MedStar in Georgetown, Johns Hopkins, and also Gallaudet University, where I go to school. We also do some vestibular testing.
We'll go ahead and email the handouts so you will have access to those either prior to this talk or after the talk. And here are our references. Thank you so much for listening and have an excellent balance awareness week.
Yeah, thank you so much.